Hello everyone, I am Dr. Kilpatrick. Today we're going to talk about how to make the aldosterone and renin test perfect. We'll review the most common mistakes, patient preparation, medication consideration.
If you have been doing everything right, taking your medication, watching your diet, but your blood pressure is still stubbornly high, you are not alone. The problem might actually be hiding in your hormones. This condition is called primary aldosteronism, or PA. It happens when the adrenal glands, small organs sitting on top of your kidneys, produce too much of a hormone called aldosterone, which forces the body to retain salt and expand blood volume. Compared to standard high blood pressure, patients with this hormonal imbalance face double the risk of stroke and over 3 times the risk of developing atrial fibrillation. Because excess aldosterone causes direct damage to the heart and kidneys independently of the blood pressure itself, the stakes of leaving PA untreated are significantly higher. Fortunately, your doctor can identify this condition with a simple blood test that measures the ratio between 2 hormones, aldosterone and renin. But here is the challenge. These 2 hormones are incredibly sensitive. Their levels in your blood can swing wildly based on your daily habits, what you eat, and the medications you take. To get an accurate reading, we need to measure your body's true hormone baseline. Following a strict set of preparation rules is the only way to prevent a false result, giving your doctor the clean data they need to protect your cardiovascular health. Step 1 begins weeks before the actual test. You need to sit down with your doctor and review your current blood pressure medication list. Certain medications interfere heavily with renin and aldosterone. Diuretics and MRAs are paused 4 weeks out. ACE inhibitors and beta blockers 2 weeks before test day. Never stop these on your own. Your doctor will prescribe safe alternative medications to keep your blood pressure controlled. By carefully clearing these specific drugs from your system, we remove chemical interference. This allows the blood test to capture your unmasked, true hormone levels. In the days leading up to the test, you must follow a rule that goes against everything you have been told about high blood pressure. Do not restrict your salt intake. On a low-salt diet, your body holds on to sodium by artificially spiking aldosterone levels, completely ruining test results. Instead, eat a liberal amount of salt. Also eat plenty of potassium-rich foods like bananas and potatoes, since low potassium can trigger a false reading. There is one specific food you do need to avoid entirely: natural black licorice. Real licorice contains a compound that acts exactly like aldosterone in the blood, so check the labels on your teas and candies and stop consuming it at least 2 weeks before your appointment. Temporarily setting aside your low-salt diet ensures we do not accidentally hide the exact hormonal imbalances your doctor is trying to find. On the morning of your blood draw, we have the 2-hour rule. You need to be awake and physically up and moving around for at least 2 hours before the needle goes in. Try to schedule your appointment between 8 a.m. and 10 a.m., which is when your hormones are naturally peaking. And keep your morning calm. Strictly avoid any strenuous exercise. When you finally arrive at the clinic, there is one last hurdle. You need to sit completely still, with feet flat on the floor, for 5 to 15 minutes immediately prior to and during the blood draw.
Before and during blood draw, do not make a fist and remain relaxed.
This document shows the technical guidelines doctors use to diagnose primary aldosteronism. The math used to calculate your test results is highly precise, and it specifically requires the blood to be drawn while you are in a seated position. Because simple changes in your posture can shift hormone concentrations in a matter of minutes, sitting perfectly still is your ultimate guarantee of a clean, readable test. The moment the blood is drawn, your preparation is complete. You can immediately return to your regular diet and resume your normal blood pressure medications. Keep in mind that hormone tests are notoriously sensitive. Your doctor might request a second test if your potassium levels were slightly off, or if traces of previous medications lingered in your blood. A successful, clean test gives your medical team the data they need to provide PA-specific therapy, such as mineralocorticoid receptor antagonists or even curative surgery. For many, this finally brings blood pressure into a healthy range and stops the progressive damage to your heart and arteries. Following this precise preparation blueprint is the definitive first step to protecting your cardiovascular future. To help you stay on track, download the printable checklist linked in the description below.